We're going to talk about imaging use for patients with lumbar stenosis and claudication. And so typically for patients who have had symptoms for more than 6 weeks or so, we'll start with x-rays of the lumbar spine, and eventually really to make the final diagnosis you need an MRI scan of the lumbar spine. For those patients who cannot get an MRI scan, we'll get a CT myelogram if there is a contraindication to getting the MRI scan. And those typically are patients who have a pacemaker, patients who have spinal cord stimulators or other implants that prevent them from getting an MRI scan. In that case, we'll get a CT myelogram to assess for spinal stenosis. Just like assessing any x-rays, you want to, number one, make sure that the patient does not have transitional anatomy so that we are counting the right levels. For example, in this case, the patient does have transition anatomy. You have, this is L1 here, L2, L3, L4, and L5, which is this guy, is actually partially sacralized, which you can see on the lateral as well. This L5 is partially sacralized. So these, it's important to know whether there's transitional anatomy or not so that you can count the levels appropriately. The other thing you want to look at on x-rays is the presence of spondylolisthesis, which in this case, we can see that this L4 segment is a bit more anterior compared to L5 here. And so this patient has spondylolisthesis, and this can play into our decision for treatment. And then on MRI scan, we assess for compression or the stenosis. And so here on the bottom, this is what a normal spinal canal is supposed to look like, that you have all these nerves that are free and we have a lot of CSF around the nerves. But as you can see in this top corner, this patient has severe spinal stenosis where there's a disc bulge in the front that's compressing, and then you have ligament as well as facet hypertrophy from both sides that's really squeezing the canal so that you're left with this little triangular region as opposed to this large oval shaped region for the nerves. And so that's spinal stenosis, and that's how it looks like on the MRI scan. There are different locations for the stenosis. If you have you can have central stenosis, which is shown in this MRI picture here. We can have lateral recess stenosis. Lateral recess is essentially the region which is medial to the pedicle and is lateral to the bulk of the dura. So this region here on the MRI scan on both sides is considered the lateral recess. In the middle, this region in the middle, that's considered central. And then you can have foraminal stenosis, which is a bit more lateral in the foramen. As you can, and the best image to look at the foraminal stenosis is really a sagittal MRI scan that I'm showing here. So this sagittal MRI scan is going to be the best one to show the foraminal stenosis. And you can see at the L4, L5 level, there's the disc bulge here, causing a lot of foraminal stenosis for this nerve. And so this patient now has foraminal stenosis as well. So these are the three typical locations of stenosis. You can have central, you can have lateral recess, and you can have foraminal stenosis.